Hey everybody, it's Joe here at Victory Wellness in Cincinnati. There's also a location in Naples, and I'm here with Dr. Magdalene Kerschner. And I've come in because as I get older, I'm kind of gaining a little paunch around my belly, and I've been hearing about a new craze in weight loss, peptides or something like that. What are we talking about here?
Oh yes, Joe. So there is the latest craze. It's all over social media, and it's the newest peptides for weight loss. FDA approved medications that actually work this time. So these are peptides, GLP-1 agonist peptides, and they're injectable once a week. You come in for injections, little injections, and what they do, they actually enhance your metabolism, improve your metabolism to favor weight loss, which is amazing because you actually get healthier on these medications, and it's approved for long-term use for maintenance. So those of us that have a really hard time maintaining, for example, maybe we are able to lose 30, 50 pounds if we really discipline ourselves, but we can't stay lost. Great drug.
And yeah, that's the hard thing, is keeping the weight off, right?
Absolutely.
And when you have that kind of weight, like I have problems with cholesterol, and you were showing me some your results earlier of cholesterol loss over what, a 5-year period?
Mm-hmm.
What were those? How does that impact that, and how does it?
So I just went and had my metabolic panel done. Just I get it once a year, every few years when I remember. And so what I noticed that my cholesterol right now is 170, and 5 years ago was 230.
Oh,
so
gosh.
without any medications, just to healthy lifestyle and of course bioidentical hormones and weight loss, my cholesterol dropped at least 50 points without any medication. So as I am getting older, I'm getting healthier, metabolically healthier, which is good news for me.
Of course.
And I like the good news for all of you out there, because it helps us to lead quality lives longer.
Because cholesterol impacts everything, your heart, it can impact your energy levels, anything like that. So you want to get a lower cholesterol level as you lose weight and become healthier.
Absolutely. So cholesterol is basically a fat deposit in our arteries, which is linked to strokes, heart attacks, right? For a long time we've been hearing about cholesterol. People are putting on statins to lower cholesterol because it is a risk factor for heart disease, big risk factor. So yes, we do want our cholesterol normally less than 200 for to optimize our health and significantly decrease our risk of having a heart attack or stroke.
And losing weight, and with some of the new FDA approved like peptides, the statins sometimes can be bad for you. Like sometimes you hear bad things about them, right?
Oh, absolutely. Statins are used to lower cholesterol, but they do have side effects. For example, 40% risk of dementias.
Oh my God.
Alzheimer and all various dementias, myopathies or muscle degeneration. You often hear people that are put on statins, but they can't lift their arms or have difficulty walking because they get muscle weakness. Liver disease and neuropathy are associated with statins, and many people cannot take them for that reason.
So this is a much healthier way.
Oh, absolutely. To naturally actually improve your metabolic panel is much healthier.
So I'm going to come in. I'm starting this weight loss journey. As a patient, what do I do? How does it start?
So what we would do, you would come in, we'll talk about your past medical history, medication that you're on, your previous weight loss attempts. We will measure you, weigh you, estimate your BMI based on metabolic rate, and then see if you're a candidate for that particular treatment or maybe another treatment. There are many different treatments for weight loss today that are FDA approved.
And you mentioned the particular treatment, you come in weekly and get an injection?
The peptides are injectables, but we also have Adipex, phentermine, Qsymia, Belviq, other medications that can be used to help weight loss, to assist in weight loss.
And I was on the YouTube channel and I saw lots of great testimonials about your weight loss program and about the bioidentical hormone program. They kind of go hand in hand, right?
Absolutely. Bioidentical hormones help our metabolism to return to more youthful time when we were in our 30s, where our bodies just work a little bit better. Like it's evidenced by my own cholesterol that has dropped quite a bit in 5 years. And then but sometimes our insulin gets sluggish as we age, gets lazy. It's a major hormone that regulates blood sugar. So the peptides help to regulate insulin and blood sugar and assist in weight loss.
And a lot of from what I read and from the videos I watched, a lot of the effects that you attribute to aging are actually just low hormone levels.
Well, absolutely. Well, as we age, for example, for women, menopause, we all are familiar with that term. We basically, I call it train derail. At about the age of 52, we lose our vital support. Estrogen helps to regulate the brain. Receptors are found in the brain, in the heart, in the bones, in the uterus. It's much more than just reproductive age. It basically controls a lot of our function as women, our quality of our skin, sexual functioning. It's all under estrogen control. Then we lose progesterone, another vital hormone. We can't sleep because it's an anxiolytic hormone. Actually, it helps us relax. There are GABA receptors in the brain for progesterone and serotonin. You know, so we lose all that. They also are called anabolic hormones, testosterone or progesterone. That means they help the body to build up, to continue living, basically. You know, versus catabolic, which makes things break down. So it kind of goes anti-aging and helps to build for the body as opposed to break down.
So for a guy, like lifting weights as you age, it seems like it gets harder to gain muscle mass.
Absolutely, because you guys have what's called testosterone, major hormone, so you go into what's called andropause.
Okay.
And you progress after the age of 35, you lose testosterone, and testosterone is responsible for muscle buildup, right? Exercise tolerance, energy levels. It also helps to speed up metabolism and redistribute fat from the dangerous visceral fat in the abdomen.
That's where I'm at.
To other areas, and help you to lose weight. So, you know, testosterone basically controls a lot of functions in our body too. It's also called anabolic hormone, but it has a big effect on the brain, prevents Alzheimer's disease, increases libido. You know, many people complain of lesser libido with age as well. It's under testosterone control. And of course improves sexual functioning for men.
Oh, okay. So all of these things kind of roll together, it seems like. You have the weight loss, peptide treatments, bioidentical hormones affecting men and women to help you eliminate these signs of aging, get in better shape, and just have a overall better quality of life.
Absolutely, for longer.
And you can find out about all of this stuff in Cincinnati, www.victorywellness.com, and in Naples, www.victorywellnessnaples.com. Thank you very much.
Thank you.